RSV is on the rise in parts of the country, the virus leaving pediatric beds near capacity at some hospitals as a shortage of the vaccine persists. ABC's Eva Pilgrim has more.
A warning to parents of small children. RSV cases are on the rise and now overwhelming hospitals in some states. In Texas, health officials now sounding the alarm.
That's a patient checking in about every 3 minutes.
In Fort Worth, Texas, officials at Cook Children's Healthcare System say they treated 240 RSV cases over the last week alone.
It was an emotional roller coaster. I didn't know if my baby was going to be okay.
Parents of 10-month-old Connor Cotton say he was diagnosed with pneumonia and multiple viruses, including RSV, after he had trouble breathing after a surgery. He's still on a breathing machine. His mother says the ICU where he's being treated is full.
When we arrived at the Texas Children's emergency room, it was overflowing.
RSV is a respiratory virus that for most only produces mild cold-like symptoms, but for young children and older adults, the virus can be deadly. A new shot to protect babies against RSV was approved earlier this year, but supply has been limited. Because of the shortage, last month the CDC advising hospitals and clinics to only give the shot to the most vulnerable. And now pediatric emergency rooms are bracing for what could be another triple-demic season: RSV, flu, and COVID.
Unfortunately, all pediatric hospitals are bracing for impact. We are still very early on in the winter season.
Now, as far as when these much-needed shots for RSV could be available, well, a federal health official says they anticipate tens of thousands of doses as early as this week.